Considering bariatric surgery as a solution for obesity? It's a specialized surgical procedure designed to help individuals struggling with severe obesity achieve significant weight loss. Obesity, a complex health condition affecting millions worldwide, often requires more than traditional treatments like diet and exercise. Bariatric surgery offers a promising approach by altering the digestive system to promote weight loss and improve overall health outcomes. Today, we'll explore what bariatric surgery entails, its role in treating obesity, ongoing research advancements, and the broader impact on health and quality of life. Bariatric surgery is a medical intervention designed to address severe obesity, which is recognized as a disease with significant adverse health effects. These effects can include increased risks of cardiovascular disease, type 2 diabetes, certain cancers, and reduced life expectancy. For individuals who have struggled to achieve sustained weight loss through non-surgical methods such as diet, exercise, and medications, bariatric surgery offers a potentially life-changing solution. The decision to undergo bariatric surgery is typically based on guidelines established by a National Institutes of Health (NIH) consensus panel in 1991. These guidelines initially recommended surgery for individuals with a body mass index (BMI) greater than 40 or a BMI of 35, 40 with obesity-related comorbidities such as diabetes or hypertension. Over the years, these criteria have proven effective in identifying those most likely to benefit from surgical intervention. Research indicates that conventional methods like intensive lifestyle interventions, including diet and exercise, can lead to an average weight loss of about 10% in the first year. However, maintaining this weight loss over the long term is challenging for many due to powerful biological factors that affect metabolism and appetite regulation. Pharmacotherapy, or the use of medications to aid weight loss, can provide short-term and sometimes longer-term benefits. However, for individuals with severe obesity, these treatments often do not produce sustained results that significantly improve overall health outcomes. In contrast, bariatric surgery offers a more robust solution by altering the digestive process to promote weight loss. Common procedures include gastric bypass, sleeve gastrectomy, and gastric banding, each with its own mechanisms for reducing the stomach's capacity or altering nutrient absorption. The outcomes of bariatric surgery are highly variable but can lead to substantial weight loss that is sufficient to improve or even resolve many obesity-related health conditions. Studies have shown that surgical intervention not only results in significant weight reduction, but also improves control over comorbidities like type 2 diabetes, hypertension, sleep apnea, and joint pain. Over the past 2 decades, the criteria for bariatric surgery have evolved to include consideration of BMI, as well as the presence and severity of obesity-related comorbidities. Recent updates have expanded the indications to include individuals with a BMI as low as 30 who have specific health conditions like type 2 diabetes that may benefit from surgical intervention. Pre-operative psychological assessment is a critical step in evaluating candidates for bariatric surgery. It aims to identify patients who may benefit from psychological intervention before surgery, or who may face risks that could contraindicate the procedure entirely, such as active substance abuse. While there is no universal requirement for mandatory preoperative weight loss across all patients, those with severe obesity and associated comorbidities may be recommended to undergo preliminary weight loss efforts. Psychological evaluation before surgery serves multiple purposes. It can detect underlying psychopathologies like major depression, binge eating disorder, or substance abuse that could impact surgical outcomes. For some patients, these findings may necessitate additional assessment or intervention before proceeding with surgery. Moreover, preoperative psychological assessment has shown promise in predicting post-operative success, including the likelihood of sustained weight loss. Bariatric surgical procedures have evolved significantly from earlier approaches categorized as restrictive or malabsorptive. Contemporary understanding emphasizes the complex interplay of neural and endocrine mechanisms that influence eating behaviors, satiety, and energy regulation. These insights have reshaped surgical strategies to achieve more tailored and effective weight loss outcomes. Roux-en-Y gastric bypass, RYGB, developed in response to earlier complications associated with malabsorptive procedures, involves creating a small gastric pouch and redirecting ingested nutrients away from a portion of the stomach and upper small intestine. This procedure minimizes malabsorption of energy-containing nutrients while potentially requiring lifelong monitoring for deficiencies in calcium, iron, vitamin B12, and other micronutrients. Sleeve gastrectomy, another common procedure, involves removing approximately 80% of the stomach to form a tubular structure along the stomach's lesser curvature. While it primarily restricts food intake, gastric emptying remains relatively accelerated compared to other techniques. Biliopancreatic diversion with duodenal switch (BPDDS) combines sleeve gastrectomy with an intestinal bypass to create both restrictive and malabsorptive effects. Despite its effectiveness in achieving substantial weight loss, this procedure is less commonly performed due to its higher risk profile, including short and long-term complications. Implantation of devices has expanded the options available for treating obesity, offering innovative approaches beyond traditional surgical techniques. Adjustable gastric banding. This procedure involves placing an adjustable gastric band around the upper part of the stomach. By constricting the gastric pouch and outlet, it restricts food intake and controls the rate of gastric emptying. Adjustment is possible using a balloon connected to a subcutaneous port, allowing for personalized management of weight loss and dietary habits. Intermittent vagal blockade. Implemented by positioning leads around the vagal trunks at the diaphragm, this procedure induces intermittent vagal blockade. It aims to reduce appetite and promote early satiety, addressing neural adaptations observed in previous procedures like truncal vagotomy. This method has been supported by recent FDA approval, highlighting its potential for managing obesity through innovative neuromodulation. Gastrointestinal endoscopic devices. Advancements in endoscopic technology have led to the development of various devices and suturing procedures designed to treat obesity. Among these, the placement of gastric balloons has gained FDA approval. These balloons function by occupying space in the stomach, leading to a sense of fullness and aiding weight loss efforts. Ongoing research continues to explore new endoscopic techniques aimed at enhancing effectiveness and safety in treating obesity. These implantable devices represent a promising frontier in obesity treatment, offering less invasive alternatives to traditional surgical interventions. They cater to diverse patient needs, providing tailored solutions to support sustainable weight loss and improve overall health outcomes. As technology advances and clinical experience grows, these devices are expected to play an increasingly significant role in combating obesity and its associated health risks. Bariatric surgery, while effective in addressing severe obesity and its associated health risks, requires careful consideration of potential complications. Historically, bariatric surgeries like gastric bypass carried significant perioperative risks, including mortality rates up to 2%. Advances in surgical techniques and safety protocols, coupled with the shift to laparoscopic procedures, have significantly reduced these risks to as low as 0.3% for 30-day mortality in recent studies. The LabS Consortium, a NIH-funded research initiative, reported favorable outcomes with a laparoscopic gastric bypass, showing a mortality rate of 0.2% compared to 2.1% for open gastric bypass. Serious complications occurred in 4.1% of patients overall, with higher rates observed in more invasive procedures. Longer-term complications such as intestinal obstruction, marginal ulcers, hernias, and gallstones are also documented post-surgery. Metabolic issues like nephrolithiasis and hypoglycemia, alongside nutrient deficiencies, for example iron, vitamin B12, may arise and require ongoing monitoring and supplementation. Specific to adjustable gastric banding, LAGB, complications like erosion of gastric walls and band slippage occur at a rate of approximately 2% per year. Declining use of LAGB in recent years reflects concerns over these issues and modest long-term weight loss outcomes. Gastrointestinal endoscopic devices offer a less invasive alternative, yet long-term data on effectiveness and safety are still emerging. Initial reports indicate modest weight loss benefits with good safety profiles, though sustainability beyond the initial intervention period remains uncertain. Additionally, the evolution of bariatric surgery has seen a shift towards personalized treatment approaches that consider individual patient characteristics and preferences. This trend aims to optimize surgical outcomes by tailoring procedures to better suit each patient's specific needs and health conditions. Surgeons and healthcare teams now emphasize comprehensive preoperative evaluations, including psychological assessments, to identify potential risk factors and ensure patients are well prepared for surgery both physically and mentally. Furthermore, advancements in surgical technology continue to enhance safety and effectiveness in bariatric procedures. Innovations such as robotic-assisted surgery and improved surgical instruments allow for greater precision and fewer complications during operations. These technological advances not only contribute to reduced surgical risks, but also facilitate quicker recovery times and improved patient satisfaction post-surgery. In navigating the decision to undergo bariatric surgery, patients are increasingly benefiting from multidisciplinary care teams that include nutritionists, psychologists, and specialized nurses. This collaborative approach provides comprehensive support throughout the entire treatment journey, from initial consultation to long-term follow-up care. By addressing both the medical and emotional aspects of obesity management, healthcare providers can better empower patients to achieve sustained weight loss and improved overall health outcomes. In conclusion, while bariatric surgery has evolved to minimize perioperative risks comparable to other common surgical procedures, ongoing vigilance is essential for managing long-term complications and ensuring optimal patient outcomes. The decision to undergo bariatric surgery should weigh the benefits against potential risks, with comprehensive preoperative evaluation and post-operative care essential to mitigating complications and maximizing success.